Hello, I'm here to introduce you all to something called the STEADI Rx tool. My name is Lauren Welch. I'm a clinical geriatric pharmacy practitioner working at the VA here in Madison. I'm also part of the Geriatrics Research, Education, and Clinical Center within the VA as well. So many of you may be familiar with the CDC STEADI program. So the RX is a newer kind of medication forward focused version of the CDC STEADI program that exists. So the outline for today is we'll kind of review the rationale for why they thought creating the STEADI Rx tool was a good idea. We'll understand the research and how to actually utilize the tool in a practice setting, as well as reviewing some of the plethora of available resources that the CDC has put out as far as utilizing this tool and the availability for pharmacists as well as other healthcare providers. So the STEADI Rx program was developed by the CDC in collaboration with the University of North Carolina, Eshelheim School of Pharmacy and School of Medicine. And really the goal of it was to provide additional guidance to pharmacists in how to best screen their pharmacy patients while accessing their medications, and also providing kind of a way to intervene when we are identifying patients as being high risk for falling in the community setting. So the goal of the STEADI Rx program really was to enhance the collaboration that exists already between healthcare providers as well as pharmacists, with the goal to minimize fall risks for these patients. So how does STEADI Rx works? So essentially, STEADI Rx is designed to be a clinical process that allows pharmacists the tools to screen their patients that may be at an increased risk for falls, and then communicate these recommendations and certain alarming findings to patients' providers through a variety of resources offered through the CDC website. And the thought is that pharmacists in the community setting are primed to be at the forefront of this initiative and really help to identify high-risk individuals early on, and then help to aid in that collaboration between patient and their healthcare team to then further reduce fall risk for these patients. So essentially, STEADI Rx is a four-step process, starting with pharmacists screening patients for fall risks. Then they're able to identify those at risk and then perform a medication review, kind of honing in on those high fall risk medication categories that exist. Then the collaboration begins when a pharmacist then communicates these either medication fall risk concerns or otherwise to a patient's primary care teams or other healthcare teams that exist within that scope. And then the final step is then when the provider responds back to the pharmacist in regards to the shared information. And we'll continue to walk through how best to utilize these resources by using the STEADI Rx guide for community pharmacists that's located on the CDC website, and also the link here, it exists here on this slide as well. So here is the three-step algorithm of how the STEADI Rx process works. So this is just kind of a nice visual, and we'll kind of walk through this whole algorithm throughout the course of the remainder of the presentation here. And really, the goal of this is just to help community pharmacists and pharmacies help to integrate fall screening and prevention into pharmaceutical care when a patient's already directly receiving that care from the pharmacy. So the goal is to kind of minimize kind of disruption in workflow and to figure out a way that this can be best utilized within kind of day-to-day practice. So step one of the STEADI Rx tool is to screen those high-risk patients, starting with patients, any patient that's over the age of 65, taking more than 4 chronic medications, or on any high fall risk medications, or any patient that has a history of falls. So this really could be kind of a large portion of patients that might across the threshold of a community pharmacy. So this might be helpful to start thinking about who could fill this role as far as that screening process takes. So this certainly could be done by kind of frontline pharmacy staff. So thinking of pharmacy technicians, checking in patients kind of on the receiving end of new prescriptions. And kind of asking these 3 key questions. Do you feel unsteady when standing or walking? Are you worried about falling? And finally, have you fallen in the past year? And if the answer is yes, how many times, and were those falls with any injuries? So as far as those high fall risk medication categories that exist, thinking about are patients on any psychoactive medications, opioids, medications, or essentially any medication that can cause kind of sedation or sleepiness, as well as some confusion, or any medications that can kind of lower blood pressure and cause that hypotensive. And a lot of these kind of screening forms exist on the CDC website, but again, they can be linked here on the slide as well. So my patient didn't screen positive. So essentially, they didn't answer any questions as yes in those 3 kind of initial screening questions. So the question is that all that I can offer them? And the answer is no. So there's a lot that we can also do on the CDC's website. There's a couple of additional resources, kind of patient-friendly brochures that exist. So patients are still wanting to lower their fall risk. You can print out additional information for them. So what you can do to prevent falls, so a kind of patient-generated self things that patients can do at home, as well as this brochure that kind of outlines how to do appropriate chair exercises to minimize their future falls as well. And finally, what we can also do is patients can engage in either home or community-based exercise programs. Thinking about community-based Tai Chi programs, and all of a lot of those additional resources can also be accessed through the CDC STEADI program online. So step 2 of the STEADI Rx process is to assess modifiable risk factors. So after we've documented answers to the 3 key questions initially and provided education initially to patients, what is next? So the next step would be to identify medications that increase patients' fall risk. So this should be done by kind of a formalized medication review with a patient. And so scheduling that can be done kind of at that initial screening. And, figuring out kind of a workflow, we'll kind of talk about that towards the end of the presentation, should be kind of on the forefront of everyone's mind about how this is going to kind of work out in the community pharmacy kind of setting. So once a patient is scheduled, again, Study RX has kind of this community pharmacy fall risk checklist. So this helps guide pharmacists in kind of creating or walking through that medication review with patients. And this also kind of links to kind of geriatric specific medication decision support tools that are also available. So again, those um, screening questions exist here, and then kind of thinking about specific classes of medication that carry that fall risk designation. And when kind of walking through their medication list, we should be thinking about the name of the medication, what the dose is prescribed, and what kind of are the instructions for use, and who is a prescriber. So at follow-up, we can kind of quickly ascertain who do we want to provide specific recommendations for follow-up to. And again, all of this can be accessed on the CDC STEADI Rx website, but this specific community pharmacy fall risk checklist can be accessible by linking on the link here on this slide. Technicians can also be really valuable in collecting some of the medication ahead of time to streamline the purposes of this visit. So you want to make sure you're kind of gathering all that information by talking with caregivers and seeing how med management might be going at home for some of these patients, also from maybe primary care providers or specialty providers, getting kind of updated medication lists based on, in addition to kind of your dispensing records, as well as maybe accessing controlled substance monitoring databases, so you kind of have that big, broad picture of what's going on with a patient and what they're taking. So in addition to kind of the medication review, we want to be thinking about why are they taking specific medication. So what's the indication for use? Looking at doses. So is the patient on an accurate dose, the prescribed dose? And is that prescribed dose kind of within the realms of kind of appropriate schedule and dosing for the patient? Asking the patient, is this medication helping you? Or are they having any sort of expressed safety concerns with possible adverse drug reactions to the medications? Also thinking about adherence to the medication. So are they struggling to adhere to medication instructions based on, are they taking medications 3 different times a day, but getting that midday dose in is really challenging to the patient, so really they're not getting the appropriate intended prescribed dose. And then lastly, thinking about the American Geriatric Society Beers list and that potentially inappropriate medication list that another presenter will be kind of outlining as far as, are these medications on that list or not? So walking through a step 2 of the process, again, assessing those modifiable risk factors. So asking questions of the patients, are they having any symptoms of feeling hypotensive or having low blood pressure, or blood pressure that's normal and then all of a sudden drops pretty low? So are they any symptoms of dizziness or lightheadedness, especially when they go from kind of waking up in the morning, so lying flat onto standing? Are they checking their blood pressure at home, and are they noticing any changes and drops in blood pressure that might be a result of certain medications that they are taking? And then finally, other modifiable risk factors are, what pharmacists can do in kind of those medication focused visits to educate patients on fall prevention and again, that referral to community-based fall prevention programs. And this can be also found on the CDC website or linked here, but the National Council of Aging has state fall prevention coalitions kind of formulated by state that can be an additional nice resource and option to provide patients as well. So the final step of the STEADI Rx program is that coordination of care. And so this essentially happens with either primary care providers or that prescribing providers to further kind of close the loop, if you will, to reduce identified risk factors using effective interventions. And so really there's a couple of different ways that this happens. So one is kind of sharing any sort of medication related issues that were identified during that medication review with a patient. And this can be done through a STEADI Rx form that's available on their website or linked here on the slide. But essentially, you've kind of screened the patient, and all of that can be communicated on this form. And then also kind of identifying specific medication recommendations that are that you and the patient maybe have come up with together. So recommendations included here should provide specific dosing adjustments when available, or recommending kind of safer alternatives through utilizing the Beers list and other kind of tools that are kind of out there. And establishing some communication flow between different provider offices can be really helpful to do so up front. So how do these providers want to receive some of these recommendations that you're providing them? Is it through fax? Is it through electronic messaging, if that's available at your site, or through phone? And then again, who is going to be following up on these recommendations from both the provider office standpoint, but also from the pharmacy that's kind of recommending those as well. So not all patients may require medication adjustments or changes to medications after that initial medication review is done by the pharmacist. However, the American Geriatric Society does still offer recommendations that all patients who screen at risk should be assessed for additional risks. And this is an additional STEADI Rx form that kind of highlights that to providers. So if you are screening these patients in the pharmacy setting, communication with patients' providers for follow-up is recommended, and this form can kind of help provide providers with that additional information and kind of what the next step or what that next ask might look like. So that kind of concludes the whole algorithm of using the STEADI Rx algorithm workflow, if you will. So thinking about how to get started utilizing the STEADI Rx program, either at your site or getting other kind of pharmacies involved, is kind of really key. So included a few kind of helpful tips and tricks on this slide here, but identifying a site champion is going to be kind of pivotal. So who is going to be that point person to ensure implementation, documentation, and follow-up kind of occurs throughout that whole process? So seeing that process from start to finish with each individual patient and kind of tracking that is really kind of key. The site champion can also be the one that helps kind of promote the service within the pharmacy. So getting patients on board, getting providers on board, that type of thing. Also kind of incorporating relevant trainings as needed as far as different staff members that might be involved in the STEADI Rx program in the community pharmacy settings. Assessment of readiness is also key. You don't want to kind of hit the ground running when you don't have all of your ducks in a row. So thinking about who might benefit from those services and how you might screen some of those patients up front. Thinking about staffing. Do we have the right number of staffing to kind of add this additional service? Is there kind of upper management or upper leadership that needs to kind of be bought into this process, and are they on board before we kind of hit the ground running? And then are there other services that are currently being offered at the pharmacy that maybe could kind of include the STEADI Rx program within it? So thinking about kind of current medication therapy management programs that are already being offered, and is this something that could be kind of looped into pre-existing services? And finally, that communication and providing collaboration with the providers is critical. So making sure up front we're having that appropriate two-way communication established will really kind of set this program up for further success. So kind of when you're thinking about, collaborating with these other primary care providers or specialty providers, this is a helpful kind of tool that outlines what the STEADI Rx program is. So again, this is available on the CDC STEADI Rx website, but can be linked here. But this is just kind of a nice one-pager that outlines what the STEADI Rx program is and how it might benefit some of these primary care provider patients. Another thing that exists that also might encourage patient interest is these pharmacy auxiliary labels that have been created through the CDC website that can be affixed to high fall risk medication bottles. So if you're running to kind of have patient driven referrals, if you will, providing some of these on a high fall risk medication might be helpful to kind of get the patient buy-in as well. So hopefully this kind of gives you some ideas to kind of think about that might be helpful for your patient population, maybe your community pharmacies, maybe your primary care pharmacies that work closely with community pharmacies, to just kind of start that process and start that communication with how some of these patients might benefit from this type of service or program locally. Thank you so much for your time, and hope you found some useful information here.